Good afternoon, everyone, and it's a pleasure to welcome you to today's webinar on the topic, the transformative role of artificial intelligence in healthcare. As we all have become aware, AI has emerged as a powerful tool and a game changer in reshaping healthcare and optimizing how services are provided ultimately and helping to improve patient outcomes and the rest. Today, we'll dive deep into this topic, trying to understand the current trends, the challenges, and also opportunities available for us in AI adoption in healthcare, just as a way to understand what the narratives are and how healthcare professionals can improve on this use of AI. Throughout the session, we'll discuss how AI is enhancing health service, making it more resilient, and also improving healthcare in times of crisis, and essentially in improving efficiency. We are very much fortunate to have very seasoned individuals who are going to help us in this conversation. But even before I introduce them, I would like to share with you some housekeeping rules so that we can all be well aware and take note of it. I will be leaving time for question and answers. So please feel free, if you have questions, just use the Q&A feature and ask your question there. At the appropriate time, we'll share this question with the respective speakers and then they will answer. Also, don't forget to follow our social media handles with the hashtag, the social media name, the Newmark World, where you can find us on Facebook, Twitter, find us on Instagram, and find us on YouTube. Feel free to also drop your questions there. The conversations will continue in that regard. And now to the speakers. Our first speaker is Gilbert Maniarakiza. Gilbert is the CEO of the Newmark Group. Gilbert has very vast experience in communication and strategy. He's been a global leader where he offers strategy to influence multiple markets, and he will be one of our speakers for today. Gilbert, can we see a wave? Great. We would also have a speaker, Dr. Efriye Kakari Bempa, who is the founder of Edro Analytics. Mr. Bempa, as I've indicated, has finance and operations certification, and he's also a PharmD doctor. He has an MSc in finance, MSc in computer science, where he combines clinical, technical, and business expertise to develop AI-powered pharmaceutical tools for the African market. So as you realize, we have the very experienced individuals who are going to take up this topic. Our last speaker would be Daniel Mafo. Daniel Mafo is the co-founder of RX Health Info Solutions, where he focuses on digital health strategy, AI-enabled healthcare system, large-scale health technology, and that sort. Daniel has over 15 years of experience, and he will be driving the conversation on the AI adoption and digital health in that regard. We were expected to have Dr. Natalie, but unfortunately, she had to attend to a personal emergency. However, she sends her regards for today's session and would be with us in spirit. Now to delve into the conversation itself, as I have previously highlighted, AI has become an integral part of the things we do. However, we have seen its adoption in the healthcare space, and it is very important for us to understand how it is shaping developments there and know what insights are within this sector and how AI is shaping it. And so I'll first begin with Gilbert. What are the current trends in AI adoption and how are they shaping the industry globally and regionally?
Thank you, Wilfred, and thank you all of you who have come to grace this webinar. I'm very excited to have this conversation with two illustrious professionals in the healthcare sector. the healthcare sector has been quite important for the Newmark Group, and I can maybe just say a couple of things about the Newmark Group. The Newmark Group is a global strategy, influence strategy firm that is empowering brands, not just corporate brands, but also individual brands across the world to build the one asset that multiplies everything, which is influence. And essentially influence is the the capability that a brand has to shape what people think, how people act, and the decisions that people make without necessarily resorting to power or coercion. And as a brand, as an organization, Newmark has been driving this for the last 16 years now, and we have gotten a chance to work with some of the world's biggest brands, including in healthcare. And actually, we've gotten to work with some of these brands that involved my co-panelists. Daniel was one of the top leaders in Africa in a very large company that has innovated significantly on the African continent. And it's very exciting to be with you here, Daniel, at this conversation. Now, let me come back to your question, Wilfred. So I'll take that question from an AI in communications perspective, because I'm sure that my colleagues are going to tackle some of the more technical healthcare aspects as they relate to AI. I want to really put a bit of emphasis on what happens on the communication side, because that is really an important area, and that's an area that we have been working on, as I mentioned, over the last 16 years. Now, uh, let me just first give a number. 91%. 91% of PR and communications professionals globally are now using generative AI as a part of their daily workflow. So they use this every single day. And in no other sector is that shift more consequential and remarkable than in healthcare. And here is why I say that this is remarkable. It's because healthcare is not a single communications environment. It has many microcosms of communication. You have behavior change campaigns, for instance, that are trying to shift deep-seated patient habits. You have patient education programs that need to translate clinical language into lived understanding. You have doctor outreach, where scientific credibility is very important, but also you have marketing efforts by different brands, and that have to navigate regulatory constraints and limitations that you don't find in any other sector. So, but that's not it. You also have internal communications, whereby communicators try to align large, often stretched and fragmented workforces. And obviously, you have crisis communications during pandemics. Obviously, you have to deal with crisis communications that can carry life or death stakes. And no other sector asks its communication professionals to hold that many distinct registers at the same time. And this complexity is really the backdrop against which AI is landing in the healthcare sector. It is why the impact is so significant here. AI is doing something that was simply not possible before. It is compressing the time between insight and action. Healthcare communicators can now, for example, monitor patient sentiment across thousands of media channels in real time, but also we can personalize messages for physicians, regulators, patients, and investors simultaneously without the sequential lag of traditional campaign development that we had before. And obviously, it's now possible to identify the right key opinion leaders for specific clinical audiences far more specifically and precisely than before. And also, we are starting to accelerate what the industry calls medical, legal, and regulatory clearance processes. And this has historically been one of the biggest bottlenecks in pharma communications. And obviously, there is something that I would call structurally significant, and that is the fact that ChatGPT is now the fifth most visited website in the world. So more than 50% of Google searches generate AI summaries, which means that now patients and I'm not just talking about young patients, but patients in general, and I'm sure all of us do it, um, are going to AI platforms and not WebMD like we used to do before, or hospital websites or our doctors' websites to ask about our symptoms, and also to inquire about medications and to get information about diagnosis and to double check prescription. This means that PR work um, that has to be done by healthcare communicators has to be such that such that it directly shapes what artificial intelligence will tell patients, not just tomorrow, but already even today. And that is a heavy responsibility of a completely different nature. When we look at this through an African and emerging market lens, we actually see that this carries additional dimensions. It means that AI is entering healthcare communication systems where traditional infrastructure is still being built. And therefore, mobile first audiences have to be taken into account. We have to think about multilingual communities. We have to think about trust hierarchies. We have to think about um, the needs of healthcare workers and their communities. We have to think about religious leaders and how they will interpret some of this information. And also, we have to take into account local figures and the influence that they carry, because we know that in some cases, the influence that they hold on the consumption of this information can be more powerful than what we can do as PR and communication professionals. And therefore, this also has to remind us of another reality. AI tools are trained predominantly on Western and often English language datasets, and these do not automatically understand our own local nuances and architectures. And therefore, we have to think about this very critically, because when AI gets healthcare communication wrong in these contexts, the consequences are not just reputational, they are also human, which brings us to a very important question of trust. And the evidence here is genuinely nuanced. On the one hand, AI is enabling healthcare organizations to communicate with greater precision and greater speed and greater cultural relevance, and that, when done well, builds trust. On the other hand, we are also seeing a flood of what experts are now calling AI slop rather, mass-produced, low-quality health content that patients really struggle to distinguish from legitimate medical information. And trust recovery in healthcare, once broken, takes between 1 and 5 years. You have to keep that number in mind. And therefore, the healthcare organizations building durable trust right now are operating from one clear principle. AI has to be used for velocity. Humans need veracity. And therefore, we have to use AI to move faster, but then use human expertise to ensure that what moves is actually true, accurate, and emotionally intelligent, and culturally savvy as well. That is not a technology strategy. It is a trust strategy. And in healthcare communications, there is no ultimate difference between the two. Back to you, Wilfred.
Thank you, Gilbert. I believe I picked some notes in terms of the complexities where you indicated scientific credibility as one, the challenge of internal communications, AI also being used for crisis communication. And I think that you highlighted that most of the AI tools that are done do not have local nuances. And so it is very difficult for them to read some of these things. From a strategic communication perspective, I realize that a lot of the conversation you've highlighted hinges on trust. And trust is very critical in this regard and when it comes to healthcare, especially in the use of AI. So, what are the strategic communication opportunities to address some of these challenges like trust, especially for health communicators or for health professionals who are including AI tools in their work?
So in terms of the opportunities, we have to think about what AI is really good for, what it is optimal for, and what it is not as optimal for. We know that it is optimal for processing large sets of data. We know that it is optimal for speed. We know that it is optimal for automations as well. And therefore, there are opportunities across the board to leverage these strengths that AI brings to the table. And I would challenge any communicator to take time to study how they can incorporate and bring in these strengths that AI brings to the table. And I would therefore not necessarily just frame it as an opportunity question, but it's also a process question. The opportunity will depend on the processes that ultimately the various healthcare stakeholders put in place to be able to leverage the benefits that come from the use of AI. So I would definitely encourage these stakeholders to, one, take some time to map out what are the various processes that can be automated to reach more scale and to achieve greater speeds in terms of communication, in terms of trust building, in terms of delivering the information that specific stakeholder groups need. And that process question is really, in my view, not just a matter of saying we can do A, B, C, D in this order. It's also an opportunity to shift the culture that we have in most healthcare ecosystems. As you know, healthcare tends to be dominated by public sector players. And public sector players, unfortunately, especially in the developing world, are not known for innovation and speed. And to really draw the benefits of AI, one has to have a bias for speed, which means the culture that that exists in most of these public sector ecosystems has to shift towards a culture of speed, a culture of solution generation. And we have to shift from being problem solvers primarily to solution architects, essentially. And obviously, that's the opportunity that we are presented with when it comes to the use of AI. And certainly, that's not a preserve of communication teams. The good thing is that communication professionals and experts can come into this conversation with a bit more authority because they're the ones interacting and in charge of interacting with the various stakeholders, external, and internal stakeholders, like I mentioned earlier. So therefore, if a government is trying to drive uptake of a specific therapeutic solution, uh, the communicator is best placed to highlight the benefits of integration of AI because already as communicators, like I said, 90% of us are already using AI. So we already are very schooled at the power and influence and capability of AI. And we can seize the opportunity that we have now to introduce the benefits and therefore hopefully shift the needle towards this new culture, a culture of innovation, a culture of speed, a culture of scale, all of which are needed for Africa to leapfrog the healthcare challenges that we have. And that's a new word that I'm sure my colleagues will speak to. The need to leapfrog the challenges that we have, and again, that's a macro opportunity that I think we have to sell, um, strategically with evidence to show that just like we leapfrogged the cabled telephone, we can leapfrog the fourth industrial revolution to get to the sixth or seventh, which essentially is AI powered. Back to you, Wilfred.
Thank you, Gilbert. Daniel, I would want to find out, I'm sure Gilbert has highlighted the communications aspect of the inclusion of AI in healthcare. We are yet to go deeper into the practicality, the use, and how it helps our health system. But then I want to find out from you, how is AI contributing to strengthening our health system, particularly in improving efficiency and resource management? Because essentially that is the brief around AI use to help us do things faster. How is it helping in healthcare in terms of efficiency and resource management, considering that you've handled a lot in that regard?
All right. Thank you very much, Wilfred. And thank you for this wonderful opportunity to be able to share my little experience and insights on this particular topic. So when it comes to the use and adoption of AI, I'm just really thinking back even 5 years. If you mentioned AI as a standard way that health systems should be operating or thinking of doing their work, this would have been very alien. I mean, healthcare is one that is steeped in a lot of processes, rules, protocols, tradition. And so getting healthcare professionals, i.e. doctors, pharmacists, nurses, to embrace AI, even 4 years ago, would have been almost like a taboo. Because I remember we had these kind of conversations a couple of years back and it was very alien. But today, what we have seen is that there is almost no conversation in healthcare, system strengthening, efficiency, that AI does not pop up. And the beautiful thing that we are seeing is that it's not just AI popping up as a fanciful word, or using something like ChatGPT or Claude or Gemini as a fanciful way of just checking a few things. It is the way it is being deeply embedded in how health systems should function and be operating. So for instance, we see currently a lot of the claims systems, both for private health insurance companies and national scale health insurance companies, embedding AI systems at the base of how they vet their claims and the healthcare bills. Because traditionally, vetting these claims and bills by human beings just going through or using a set of rules or what they used to call rule engine, it's not very efficient. But today, AI systems are running all these claims and they are in the position to process hundreds of thousands of claims per day. So in the payer space, health insurance companies have really adopted AI at the core of how they work, and it is really beginning to bear a lot of fruits. The other trend we have seen now is a lot of hospital management systems, or what we call EMRs, are now really coming fully embedded with AI systems to assist the healthcare professional to be able to do triaging faster and better, and to also help point the doctor in maybe a couple of things, a couple of correlations they may have missed. So today we see a lot of EMRs where as the doctor types their notes, they can see the assistant button there. If they click, it can probably tell them based on the symptoms and the past medical history, the person might be having these top 3-4 conditions. Or if there is some kind of particular symptom they are not really sure of, the AI assistant can help give them certain options. It doesn't mean that the AI is replacing the medical doctor. Far from it. It is rather helping sharpen the medical doctor's focus in being able to decipher and go through tons of information, excuse me, in a limited time with the client or the patient in front of them. And for us, seeing that has been very, very transformative. But one of the ones which has been the most groundbreaking, and I see a lot of tectonic shift happening there, is the diagnostic space. The way AI is able to analyze your X-ray, your lab results, your images, right? It's just transformational. Things that you may have missed if you were using your eye to be able to study an X-ray or an MRI or a CT scan. The AI today is able to help you identify all those things. And it's very instrumental because today there are very limited number of radiologists and specialists all over Africa who are available to review these results. So sometimes you could even do the scan and they will tell you that the radiologist is not around. You need to wait till next week for him to come to be able to do this. But these AI diagnostic tools are ensuring that you can review these images much, much faster. And therefore, your clinician can help make a decision in a very, very short space of time. So I'd say AI systems at the base is working in this way. At the macro level, where policy makers, decision makers decisions are being made, we are seeing AI systems sitting at the heart of all the data culminating in the health systems of countries coming through. And they are using systems ranging from Claude AI to their own custom-built AI systems to be able to review and assess the macro picture. And so ministries of health, so if you check Rwanda, Sierra Leone, they are all building national health intelligence agencies and centers where it is fully AI embedded. I know Ghana is also on a similar path, deeply embedded with AI, reviewing all the health data, meaning that your policymakers are able to make better, smarter, faster decisions. So I would say these are some of the few ways we are seeing AI really transforming healthcare. And yeah, I'll pause here for any follow-up question, comments. Thank you.
I think I'm excited about the issues that have been raised, efficient use of resources, which you highlighted very well. The speed in medical diagnosis made easy, and also the conversation you raised about access and efficiency with regards to the example you gave about radiology. Gilbert spoke about processes as a way of optimizing the use of AI. Do you think we have put enough processes in place to optimize the use of AI in the healthcare in Africa based on your practice and some of the interactions you've had?
Yeah, so currently what we are seeing is that we see a lot of government agencies, ministries beginning to write policies governing ethical use of AI and how AI should be embedded in the healthcare system. So we are currently supporting some people to review their national health information management plan for the next couple of years. And it is deeply rooted in data analytics and AI and how this sits at the center. We've also seen a number of health agencies building their own custom AI and doing now a lot more training in ethical use of AI. Even if you are using something as simple as ChatGPT, how you should go about it, what kind of information you should put in there, how you can ring fence the information. So I would say since 2024, late 2024, but increasingly, the second half of 2025, we have seen so many national systems beginning to come up with policies governing ethical use of AI, and as you build IT systems, ensuring that you have guardrails on how the AI is also being set up. So we've seen that shift, and we can see that this will be an increasing shift, right? I've easily foresee in the next 3-5 years, almost every country in Africa, their health systems at the Ministry of Health level or a major health agency having a policy document with some aspects governing ethical use of AI. Thank you.
Great. I think we can come back to Dr. Bempah. Dr. Bempah, if you are, I believe that you've been able to fix your mic. I would want to find out, especially speak specifically to health system resilience, because we saw quite a bit of that challenge during COVID-19. How is AI currently enhancing resilience of our health system to better withstand pandemics and the future shocks that will come, especially with the changing health demands?
All right. Thank you very much, Wilfred. I hope I can be heard now.
Yes, you.
Okay, beautiful. Okay. So I'll start by reframing what resilience means to us. Resilience isn't about bouncing back, it's about seeing it coming. As you rightly said, during the COVID-19 Africa and the world at large was caught off guard by poorly put in place health systems. We realized that hospital beds were filled up before we even knew what was happening. And at that point, the outbreak was already weeks old. At that point, we are reacting to something that was already happening. Now, AI's contribution is simple. It's going to turn data into time. And as Gilbert rightly said, it's about being able to reduce the time that you are going to have your data and generate it into actionable insights. Now, AI's contribution will be in threefold. First, it's going to serve as early warnings. Research has been done in a number of places, especially in Kenya, where currently they are trying to develop AI models that are going to utilize the wing beats of mosquitoes to predict vector-borne diseases before they spread. Also, the Ghana Health Service has also tried to pilot an EMA Plus platform that's going to allow veterinary officers to be able to report certain rare occurrences or diseases in real time. And all of this has gone to triple the outbreak reporting, even in the very first 6 months of their release. And these are all early warning systems that are being built today. Secondly, in terms of adaptive capacity, when COVID-19 hits, a lot of facilities had to pivot. A good example is a facility called the company Wello Health in South Africa, which is a platform that has been built for workplace wellness. What they did was to help their employers manage chronic care diseases for their staff that were working remotely. This was a tool that was already in existence, but it was adopted and adapted to the new context. And thirdly is through learning during disruption. The company InstaDeep, based in Tunisia, was able to build models that were able to detect certain variants of the COVID-19. And this detection method was faster than the traditional ones, and this allowed global health systems to prepare for what is coming. What this has taught us is that we don't have to wait for crisis to prove ourselves. There are certain systems that are already in place, and when we have certain disruptions, these become essential. At Edro Analytics in particular, we are testing how we can use pharmacy data in particular to be able to give similar early warnings that would be able to inform certain decisions before another pandemic breaks out. Because resilience isn't about what you build during crisis, it's what you build the years prior. And I actually want to lean into what Daniel said about some of the systems that are already in place to tackle some of these pandemics, because we know that when a pandemic hits, the people who have it the hardest are those in rural areas, because they are the ones that lack access to quality healthcare. And if you already have certain tools, certain telemedicine equipment, certain X-ray diagnostics in place that are very mobile, that could allow them to access healthcare. Because right now we have people who are building native chatbots in local dialect. There's a country in Nigeria that is working on that, where you can just speak to the chatbots in your local dialect, and they can give you pointers on what symptoms you're expecting, when to go to the hospital, and even reduce your rate. So, for instance, let's take the COVID-19. If an app like that was already in existence during the COVID-19 era, instead of people panicking and knowing that what if I go to the hospital and risk getting an infection, they will quickly go onto that application, speak to it, and then know what their symptoms are and know whether they are at risk and what action they have to take. There's also Welody that's also in the works that also does something similar, trying to provide authenticated health information and health knowledge for everyone. So I'll leave it here for any further follow-ups.
I like the bit of how you indicated that there is a company in Nigeria that has an AI bot that you can speak your local dialect and it provides an answer for you. I think that fits well into Gilbert's concern about local nuance reading. But then as a follow-up question, having looked at how we've done post-COVID-19 and our use of AI, do you think we are prepared for the next pandemic? If no, what can we do then?
So I won't say we are ill-prepared, neither would I say we are adequately prepared. But whatever be the case, certain measures are being put in place. Now, when we have this conversation about being prepared for the next pandemic, Africa in general, one thing we have to look at is it's not about building the next infrastructure. It's about making sure that the existing systems that are already in place connect and speak to each other. Because there is a lot of pharmacy data, there is data from clinics, there is supply logs data in Ghana, in Africa as a whole. if you're able to tap into the data mine and really build adequate data structures that help us communicate to each other and be able to forecast and do all our demanding and supply and distribution, is going to ensure that when the next pandemic should hit, we'll be well prepared because we are going to have real-time surveillance. So in terms of preparation, I won't say we are there yet. We are on our way because, as Daniel said, 5 years ago, this conversation wouldn't have been possible. But the leap that has been done and all the transformation that has taken place, even in the last 2 years, it's a step in the right direction, letting us know that should something like that happen again, we'll be in a better position than we were when COVID-19 happened.
Thank you very much. I think we've had very great insights in terms of the topic and how it relates to our everyday life, simplifying it in ways that we can even understand. I would look into the chat box if there are questions, so we can apportion some of the questions to our speakers. And I have a question here, which says that how can AI tools be integrated into existing hospital workflows without disrupting clinical decision making? I'll just note that question, and maybe I would assign this question to Daniel, because I think you spoke about health system strengthening and how how hospitals are using AI for efficiency and resource management. Maybe you can help us address this question. How can AI tools be integrated into existing hospital workflows without disrupting clinical decision making? Daniel?
Yes. Okay. Apologies. Yes. So I think from my experience and the work we've done with some of our clients, when it comes to incorporating AI tools and systems into how existing hospital or clinical flows are done, I don't think the best approach, and I want to start from I don't think the best approach, because it will lead us to the best approach, is using generic AI tools. So for instance, we see instances where doctors would end up relying on ChatGPT whilst they are consulting with someone to make a decision, right? And though it is fast, and in those instances, we trust the doctor because he's assimilating everything. When you are intentionally infusing AI, you need to first ask, what are the legal framework in which the care at the hospital or the workflow that was designed is operating? Once you ask that, you would understand that there's already some written process or document. So in a lot of these hospitals, you see they are working with the standard treatment guideline of the nation, or the standard treatment guideline. The nation would be there. Then maybe the hospital may have additional guidelines buffering how a patient should be treated. So once you understand those guardrails and what those documents are, what we see is it is rather better to work with an AI tool that is customized or built along your treatment plans and guidelines in the country as the first base. And that is why in actually making clinical decisions, it is more counterproductive to rely on a general AI platform, which is not very specific to your jurisdiction or your context to make those decisions. Once you work with AI systems which are built on the knowledge base of Africa, of specific treatment protocols and treatment guidelines in those jurisdictions, then when you are already infusing it, first, you have great confidence from the ministries of health, from the supervising agencies, from the medical teams within the hospital, because they know that this is actually giving them, is triaging and helping with everything, but within the context of how they work. And so they are more confident to, work with that tool to make certain decisions. So I would say, to me, that is actually the most important thing when you are infusing these kind of tools in there. Then the second thing to take note of is the AI is not replacing the doctor or the doctor's decision. It is an assistant. It is suggesting. It is helping them to see things well. So if we position AI as a replacement, and unfortunately, that is the language tech speaks a lot. AI is coming to replace. AI is better than human beings. No, the AI is helping the human being to make better, faster, smarter, more comprehensive decisions. So the communication, and that's where I'm sure Gilbert will be excited, the branding, how you position AI in healthcare is not a replacement. It is an assistant, a helper, right, to make things better. So these are my thoughts on this. Thank you.
Thank you very much, Daniel. Very comprehensive. It felt as though you were a medical doctor itself, but it's exciting that you've been able to provide such an answer. I think I have another question here that focuses on what are the most common operational barriers to implementing AI in African healthcare setting. I think I would cede this to Dr. Bempa. Just to help in the conversation, I think one of the barriers spoken about is the local nuance reading. Maybe you may want to continue from there, especially on its adaptive capacity of AI.
Thank you very much, Wilfred. So with some of the operational barriers, as you mentioned, and as Daniel also said, it's mainly about having the AI being trained on local data. And even before you start the conversation, you should look at the medical legal issues that could happen. And with AI in healthcare, we are most particular about patient privacy protection. Because as Gilbert gave in his submission, in healthcare, you're not just looking at consequences that would affect reputation, but you're also looking at lives. And in AI in healthcare, we are looking at very sensitive information that has to be protected. So as long as we're able to, the first operational barrier to me is making sure that patients' rights and patients' information is always protected. As long as you can overcome that hurdle, it makes subsequent conversations easier. So that's the first. And secondly, as Daniel was saying, most of the time, clinicians have been trained for a very long period of time. And right now, what you are even seeing is even being at the community pharmacy or even being in the hospital, you have patients who have access to ChatGPT and other LLMs that through that they're able to ask questions and they didn't come prepared with certain information, thinking that they know more than you. But you know that if you are to really probe further, you'd realize that there is what we call the AI bias, or sometimes there could even be hallucinations. And Gilbert even mentioned AI slow, because there is a limit to the knowledge that AI can give you. So another barrier would be that, as Daniel said, it's partnering with the health team that already exists, that is supposed to augment their work, is supposed to make workflow easier. So you can look at it from the administrative point of view, where right now you want to reduce the patient's wait time, you want to reduce patient documentation, you want to reduce clerking. And I think there was this health challenge, AI challenge, that took place some time back, and then there were a number of innovative tools that were developed there and then. And we saw that some of the tools included VAI, which was a medical transcription system for clinical notes. And this is going to allow doctors to have access to patients' history on the go. So maybe you have systems where the EMR may be inadequate or lacking. You'd realize that if you had a system like that, it will be able to give you real-time information. So another operational barrier is also the data itself. The health system in most places, it's very fragmented. You may have a patient who will be visiting multiple facilities, and because of that, if he's to go to a new facility, you wouldn't have access to his data. And that will be an operational challenge when it comes to adopting AI, because AI works better based on the data you feed it. So the more quality your data, the better output you can get from it. So if we're able to address that operational hurdle, then we know that that is a step in the right direction. And thirdly, I also say it's also about the attitudes. Usually the social side is an aspect that doesn't get talked about often. Because when we are looking at operational, we're always looking at it in terms of the infrastructure, but the attitudes of the personnel is also very important. how you're able to position it to the healthcare team, because they already have a modus operandi. They already have a way their workflow looks like, how they are flowing, and they are already confident in themselves. So to position AI to them, you have to look at it from their attitudes towards adopting AI to their existing workflow. I think that's what I'll say.
Thank you very much. Gilbert, I think there is a question on comms, which I believe suits you very well. And it says, how can communication teams address concerns around data privacy, bias, and ethical use of AI in public messaging?
Thank you, Wilfred. And I'm really enjoying this conversation that we are having here with Daniel and Dr. Bempa. And I believe that it is an important conversation. And this last question around addressing concerns around, concerning data privacy, bias, and ethical use of AI in public messaging, it's really a very critical question. And for communicators, one of the biggest challenges that we have to address is obviously data privacy. If data belonging to patients is being used in various AI systems, especially systems that haven't been developed by a hospital or an institution that is vested with the authority and with the accountability for that data, over that data, then it can actually be an ethical challenge. It can be a big problem. So I think that addressing concerns around that is very important. Being able to openly and authentically share what is being done to ensure that the data of patients and other stakeholders in the healthcare is safe is, in my view, something very critical. I believe the other challenge, and this has been mentioned a couple of times before by my co-panelists, is the importance of addressing the issue of bias. And I think Daniel alluded to a potential solution to this, which is a solution that involves either clinical institutions or even governments or ministries building custom-made AI-powered platforms that can then be trained on the locally relevant data, because bias is a very real and structurally significant issue, not just in healthcare, but across many other sectors. And that is essentially stemming from the fact that a lot of the large language models that we are using now are trained using populations, languages, cultures, education levels, and geographies that are not African, and not just African. I mean, you still have many other regions of the world that are underrepresented in the training databases that are, leading to the answers that we are getting. And obviously that means that as communicators, we have to be specifically sensitive to this particular issue when we are working on messages that are going to be sent out to the broader public. I believe that the other challenge that we have to think about is disclosure. We have to be able to disclose what the source of the content is. If we are going to be using AI, so of the public having a right to know when content has been substantially generated or shaped by AI ethically, especially in the healthcare sector specifically. In other sectors, perhaps the need for disclosure might not be that significant, but I, for one, believe that that might have to be one of the elements that perhaps regulatory authorities look into. And one of the things that I liked in what Daniel said, and I believe I got some echoes of this from Dr. Bempa, is that ultimately, the healthcare sector will need to adopt a number of AI governance guidelines and even policies and laws as AI becomes ubiquitous within the healthcare ecosystem. Because the reality is, as AI gets embedded into machines into data management systems, into diagnosis systems, into communication and information sharing and management systems, being able to have guidelines and policies and even laws that to some extent call us to order as communication professionals, I believe is going to be very helpful, because also sometimes it's hard for an entire profession, especially one as complex as strategic communications or healthcare communications, to self-regulate. And it's not that I'm calling for regulation of the work that we do, but to some extent you can see the sense of such regulatory measures, even if it's just in the form of guidelines. I believe that this should still be something that is very helpful. The other thing would be making sure that as communicators, we stand for accuracy, and we defend accuracy, and we fight for accuracy in terms of fact checking what we are getting from the AI platforms themselves, because the issue is not using AI LLMs. I believe that the issue is being able to quality check and fact check, and to ensure that whatever we are presenting to the public is actually fully accurate. There are other ethical considerations, in my view, for communicators. One of the things that communicators do a lot is the use of personas in our communication practice. And I think that sometimes we may be tempted to use AI generated personas. And in that sense, I believe that communicators would need to either disclose or be careful about using such synthetic AI generated personas to produce some of the messages, because that's actually where you start getting those precision issues and accuracy issues, because even AI LLMs themselves will tell you that they are not accurate. So if you take wholesale what you are getting from an AI system, and you turn that into a message without contextualizing, fact checking, looking at the culture, applying it to the local context, it can actually be a big challenge. And unfortunately, we are yet to get to that level where we have a culture that fact checks everything that is coming out. However, so far it hasn't been too bad. I believe that many senior communication leaders have taken leadership over this particular issue, the ethical issue within the Public Relations Global Network, which Newmark is a member of. We have a number of agencies that are leading the rest of us into adopting internal AI ethics mechanisms, AI committees within agencies, and I believe this should be a good practice for institutional communication teams as well, whereby there are people, there is a committee, there's a group that will make sure that there is a process in place to ensure that whatever communication or message is coming out of the organization is actually meeting the highest standards in terms of localization, precision, and usefulness as well. There are a few other things, but I think those are some of the major ones that I would like to share today. Back to you, Wilfred.
Thank you, Gilbert. I wanted to come back to you for your last words to communication professionals, but I believe that you've perfectly summarized some of these discussions, and also addressed some of the questions that have been put forward, especially in terms of the role of communicators in communicating AI strategy, and also not over-promising in terms of outcomes. But I'll go to Daniel. Daniel, would like to have your final words on the use of AI, especially targeted to clinicians. What would be your final words to us?
Yes, I would like to say that the advent of the AI is here. we are in a new era, and AI is here to stay. I think there was some years back, there were use of terms like the fourth industrial revolution and all these very interesting words. But I think even then, we didn't see AI leapfrogging those kind of Internet of Things ideology that we had. But AI is here to stay. It's now so deeply embedded with our very fabric of life, how we do things. And so as clinicians, as healthcare activists, professionals, we have to embrace it. And we need to, in the embracing, and I like some of the things Gilbert said, comes with the guidelines. How do we use this right and use it properly? Because AI is a double-edged sword. If used properly, it can augment and improve healthcare in leaps and bounds in ways that we have never seen before. If used wrongly in healthcare, it can become a disaster. And I'm sure clinicians will tell you now they see a lot of patients who think they are medical professionals because they Googled or they put a few symptoms they were having in ChatGPT. And so they think they know everything. And then they are coming to the doctor already with what they believe is their problem and what they believe should be the solution. And so it's a double-edged sword. The guidelines, the ethical rules, the communication around how to use it properly in healthcare space, both for the patient, the policymaker, the payer, and the caregiver is very important. And I think this is something we should all continue to think about, deliberate, and then use it appropriately. So those are my final words. Thank you.
Thank you, Daniel. And then I think we'll move on to Dr. Bempa. Your final words, especially to patients who are now making use of other AI just to check their medications, also check what their diagnosis is and the rest. What advice would you have for them?
Okay. So my advice primarily to such patients will be that AI is here to stay. We've already established that, and it's been very helpful and very informative across a number of sectors, even in the healthcare, that you still have clinicians who still interact with LLMs or large language models like ChatGPT and Claude. We just
The goal is not to tell patients not to use it at all, but to just let them know that they have to use it, but they have to be cautious in the use of AI. Because AI, in no shape or form that it is currently, can replace medical opinions. So that's something they have to take note of. So I would say that
resilient health systems already exist, that they are sitting in pharmacy records, clinical registers, supply logs across Ghana and Africa. And we don't need to wait for perfect systems or unlimited fundings. We can start where we are with what we have and actually build from there. Because from where I'm sitting, the patient standing behind the counter or you see at the hospital doesn't come and ask you about if there's any breakage in the supply chain. All they want is their medicine. And we know AI can help us answer yes and answer it more often. Thank you.
Thank you very much. And our guest on call, it's been a pleasure that we had this conversation. We were fortunate to have, as part of the speakers, Gilbert Manirakiza, who is the CEO of the Numa Group, who essentially looked at the communications perspective of AI use in healthcare, where he spoke about the need for us to have a process and guidelines, and also for health communicators to build scientific credibility, which he highlighted most, and also communicating trust in that regard. Gilbert, I see your hand up. I believe you want to share a bit more.
Yes, Wilfred. I just have a quick call to action and message, especially for the young people of Africa. I believe that AI in healthcare is the biggest opportunity that this generation of creators and innovators has been offered, because the challenges that we face in Africa in the healthcare sector, in my view, are ripe for disruption, are ripe for solutioning by the youth of Africa. And I usually tell those that I get to speak to, that right now is the time to become a solutions architect. And I think people like Daniel, people like Dr. Bemba are really the kind of solutions architects that are shaping and building Africa's healthcare sector of tomorrow. And tomorrow when I see a young person who says that there are no opportunities in Africa, I will turn back and tell them, no, there are tons of opportunities. Right now, governments are very keen on solutions that are AI powered, that accelerate impact in sectors like healthcare, but also other sectors like agriculture and so forth. But healthcare is one of those that, in my view, offers huge opportunities to innovators and young people. And AI, obviously, especially when you look at the ease of building systems and platforms, the ease of vibe coding, all these are a huge gift for us in Africa. So, to Daniel's point, we should see the opportunity side, because indeed it is a double-edged sword. But the positive edge of the sword is quite compelling in my view. I just wanted to make sure that I send that message out, because this is really our moment in Africa, given the demographics that we have, the youngest population, which means, in my view, the biggest potential for innovation and disruption is right here in Africa. And I would dare say that Africa's healthcare sector is the biggest investment opportunity of this century, among others, but in my view, it's one of the biggest. And I would invite people to subscribe to Newmark's channels, because we are supporting the World Health Summit regional meeting that will take place right here in Nairobi in April. And we'll have a youth event that will be seeking to catalyze some of these conversations and turn them into real opportunities. And after that youth summit, we'll have the regional meeting itself, where we'll have leaders coming from all over the world, over 2,000 leaders coming from all over the world, to come and see how to unlock the opportunity that Africa has in the healthcare sector. As you know, African leaders and heads of state have just adopted a new commitment to accelerate investment in African healthcare, including manufacturing, but also healthcare in general. So I say this without any hesitation, that this is the time for all of us to look at healthcare very differently, and to use it as an opportunity for all of us to create jobs and to create great businesses and solutions. Back to you, Wilfred.
Thank you, Gilbert. We will take the very good advice from you. I believe that the attendees here have taken this charge from you to lead the next innovators, be the next innovators of the world in some years to come. And we appreciate that conversation. As I indicated, we also had Dr. Bemba, who also shared some very good insights in AI use in terms of resilience, helping AI serve as early warning indicators. AI also ensuring that it is able to predict the next pandemic, is able to predict the next health crisis that will come. We were also fortunate to have Daniel Mafo, who also highlighted how AI is helping to enable efficient use of resources, medical diagnosis, and ensuring that patients are able to have some interpretative analysis of the medications or their illness, and also improve efficiency and access, and then the need for health professionals in general to undergo some training in the ethical use of AI, so that they can protect patient privacy and all the other challenges that comes with AI. We appreciate your time for coming to join us for this webinar. As I indicated, the conversation still continues. You can follow us on our social media handles, where you can drop in the questions. We'll also have clips and excerpts of this webinar shared on our social media handles, where you can go. If you fail to hear something, you can go back and then cross-check again, just so you can be well aligned. As indicated, from time to time, Newmark Group organizes these webinars as a way of sharing insights and building thought leadership on varied topics. Whenever you see a flyer calling for you to register for our webinar, kindly take the opportunity and do this. And once again, we appreciate your time. I've been your moderator, Wilfred Kedape, the country lead of Numa Group in Ghana, and we appreciate your time. See you the next time we communicate our next webinar, and we hope you attend in your numbers. Bye-bye.